Hello, this is Dr. Stephen Ezra West. I'm an authority on the cause and prevention of disease. I'm one of the top leading experts on that. I'm an advanced form of immunologist, and as a lymphologist and doctor of preventive medicine, doctor of lymphology also. And I have some really important news for you today, several points that I want to hit on that will sort of really solidify and really add power to everything that I've been saying during the fear pandemic that we've been in, and the antisocial distancing that we've been in is what I prefer to call it. Number one fact, and I want to focus on what we actually know about the facts, is there was a doctor on Fox News that was revealing a new study that was done. We now have test kits that can show how many people have the antibodies built up in our systems. They got a bunch of these kits and they've tested a bunch of society, and they found out that most of our society has the antibodies already built up in their system. That means that most of us have already had the COVID-19. We experienced it mostly as taking a couple of naps for a couple of days, having low energy for a couple of days. Some people who weren't as healthy also had more of a cough that went along with it. And the more unhealthy people were, the more they felt it. But this means most people have already passed the test and they're on the safe side of the COVID-19. That is not in the statistics of the popular statistics of what we've been shown by most of the what I call fake news, by the CDC or whatever. Most people are just quoting what they have to say about things. Another thing that is a fact, there's a doctor who I've published on a Facebook page called Race for the Truth, and I may have published it also on the Zero Disease Facebook group. That or Race for the Truth, you can go find the doctor who I mentioned who is there, and she's speaking of as a doctor doing autopsies. And I've heard this from more than one doctor who's been on the side of doing the autopsies, that not one single person has died from COVID-19 who has been healthy. That of all the autopsies that they've done of people who have died who have had COVID-19 have already had pre-existing health issues that were very serious. That they would probably have died from any other regular flu coming along. This is a fact. This is what we know, is that not one healthy person has died. Fact. Another fact is the average lifespan after retirement is 3 to 5 years. Think about that. That's what it's been. So forcing people to stay out of their gyms that they have paid memberships to, which, well, I believe it's a basic need to be healthy, and a basic right, a religious right, is to be physically active. And we've paid for that access to gyms. And the forcing us out of that has been a violation of our basic rights. And it opens up people, even, I don't care if they're governors or who they are, for lawsuits. I don't care how they try to cover their butts politically. That actually is increasing the risk of problems, because guess what the number 3 cause of death is? Obesity. It's almost tied with cancer as the number 2 killer now. Somehow it surpassed diabetes as the number 3 killer. A long time ago, actually. We've had an epidemic, actually, of obesity, where the COVID-19 never hit epidemic levels. You have to kill at least 1 out of 1,000 people for it to be an epidemic anywhere. And a pandemic is an epidemic on a larger scale. So you can have an epidemic in a community of any size, but then they call it a pandemic, for example, if it goes global. It's the same numeric numbers. And one of the errors that I've seen from the CDC in their definition of the word pandemic is they fail to highly define the measurement of what even that means. And you need to understand what an epidemic is. And I was raised with this research. I was lucky to have my father be as one of the greatest authorities on the cause and prevention of disease, one of the greatest leaders in the world on from an advanced immunology perspective on the life process of the cells. He's one of the greatest physiologists there is. Cellular physiology is the basis of all physiology. He discovered the engine of the cells. That's all I need to say about that. Now I'm speaking with authority. I don't need to say anything else about who I am because I was his top student. So with that aside, now I've established my authority pretty well. The word pandemic, to get it, you got to study what an epidemic is. 1 out of 1,000 it has to kill out of the total population that's living to be an epidemic. Double epidemic is where you get 1 out of 500. A plague is where something kills 1 out of 50. Okay? And, you know, heart disease, for example, has been more than 1 out of 2 for many, many years. What do we call that? That's big, big trouble is what that is. And it's been the degenerative diseases that have been the big killers. The top experts who look at the real statistics, who've known this, they say the big killers used to be the infectious diseases. It hasn't been that way for a long time. A long, long time. They haven't even, COVID-19 didn't come even close to being at epidemic levels, the 1 out of 1,000 level. Not even close, okay? Especially when you consider, when you update the real statistics, not what's being said, when the majority has already had it and passed the test of it, the majority of the population. Then it makes those numbers look minuscule. So, and this is the actual facts. Another thing is the healthcare costs have been doubling and tripling every 10 years, along with the rise in the death rates. We saw this happening. There's an article published by U.S. News and World